Today, I would like to talk to you about familial hypercholesterolemia, or FH, a common genetic disorder that causes high levels of low-density lipoprotein, or LDL cholesterol, that are present from birth. While this disorder is more common than expected, familial hypercholesterolemia remains underdiagnosed. However, FH cases can be easily and effectively identified using cascade testing, and early detection and treatment of FH can help reduce the risk of coronary heart disease and death in these patients. FH is the most common inherited cause of premature coronary heart disease among people of European descent. Very few persons with FH have inherited 2 mutations. They are literally 1 in a million. Those who have inherited 1 FH mutation comprise the vast majority of people with this disorder. They have a less severe form of the disease, but still have a high cumulative risk of coronary heart disease, greater than 50% in men by the age of 50, and at least 30% in women by age 60. So, how is FH diagnosed? After excluding secondary causes of hypercholesterolemia, FH should be considered in patients who have raised total cholesterol and LDL levels, especially if they have a personal or family history of premature coronary heart disease. A clinical diagnosis of FH is typically based on a combination of factors. First, total cholesterol and LDL levels are elevated. Among patients with 1 inherited FH mutation, LDL levels are typically twice the level that is normal and are even higher in those patients who have 2 mutations. This is often accompanied by low HDL and normal triglyceride levels. Second, certain clinical characteristics, such as tendon xanthoma or corneal arcus, may be present in either your patient or your patient's first or second-degree biological relatives. However, such characteristics do not appear in all patients with FH. Lastly, there is genetic testing. Mutations in 3 genes have been found to cause FH, with those in the LDL receptor accounting for the vast majority identified. Genetic testing is not always feasible, so a diagnosis of FH can be made using the previously mentioned clinical criteria.